Everybody's just going to get on there and laugh at my accent, so which is fine.
No. So, first I'm going to start out with, this is the Kids in Chiropractic class, but I'm going to start out with, and we touch on this same subject in different classes, so this might be familiar, but we're going to talk about everyone's vital needs. So all of us, there's things that we need to survive. There are vital needs, and you could argue different things are vital as well, but these are the ones that are primary vital needs that we all need. So food, and we're going to start with food. If we were to eliminate food from, you couldn't access food at all. Hey, Chris. If you couldn't eat at all, how long could you live without food?
I was told 7 days.
Yes. So I believe that's true, and I've seen a few different studies, but in general, what they agree on is weeks. Like you can live, you won't be comfortable, but you could if you had to live weeks without food. So food is definitely important. We need it to live, and without it, you could live for weeks without it. Water. So let's say you eliminated water. You couldn't access water at all. You couldn't drink water. How long can you live without water?
Days.
Yes. So now we're down to days. It is definitely, if we just listen to our bodies and what they tell us, water is more important to our bodies than food. And so especially when we look at like areas that we can improve upon our health, if we listen to just what our bodies say, because everybody focuses on food, water, if we listen to our bodies, is actually more important than food. So we agree water is more important. Oxygen, if we cannot breathe, how long can we live without breathing?
You don't. Minutes.
Exactly. So now we've gone from weeks to days to minutes now. So if we just listen to our bodies, again, oxygen is more important to our bodies than water or food. Now, nerve flow. So let's say we cut nerve flow, we can connect our brain to our body and our body back to our brain. That communication is severed. How long can we live without nerve flow? Well,
until.
So literally, it's like a blip. Like you're instantly dead. Like if you have no nerve flow between your brain and your body, and your body back to your brain, if that's severed, you're instantly dead. And so if we just listen to our bodies, nerve flow is by far the most important component to our health. And that's what our bodies communicate to us, because again, if we eliminate nerve flow, we're instantly dead. And the reason I say all that too is it relates to chiropractic care. The one thing that chiropractic care influences most and improves upon most is nerve flow. So when we adjust a patient, what we're doing is we're taking bones off nerves, allowing your nervous system to work better than it was when you walked in. That is by far, nerve flow is by far the most important portion of our health or a segment of our health. As it relates to our vital needs, it is by far the most important. So as this relates to kids and chiropractic care, how we started. So when kids are initially, when kids are conceived, so they're conceived and they're beginning to develop, the first system that's developed is the brain and the spinal cord, and so the nervous system that we're talking about. And so again, if we just pay attention to how we're actually made and how we're made initially, the nervous system is the most important system in our body, and then all of their systems are developed out from that nervous system. And so as we're developed as embryos and then eventually babies, like all of our parts of our body all come from the nervous system. And so again, not even listening to me or paying attention to anything I'm saying, but just if we listen to how we're designed, our nervous system is by far the number one system in our body that all of their systems are developed from. So if we just look at not even me or ourselves, but our creator, like if we listen to whoever that is for you or however you believe you were created, that system is the one that designs all of their systems. It is like the hub of all of our health. It all comes from our nervous system. As this relates to kids. So as a kid, like that's how you then originally you're made, but then as you're growing, all of your growth and all of your and especially like your brain developing, but then different parts of your body, all of that is continuing to be flowed out through your nervous system. And so there's actually studies now, and this is the first time, what I would say with medical studies and pharmaceuticals, this probably isn't news to you, but man, they've got a lot of money. and so they have a lot of studies attempting at least to prove the efficacy of their products and how effective they are. Chiropractors, like if this is the pharmaceutical company up here, like chiropractors are down here as far as just overall economic drive and impact that they have on the medical profession. In saying that though, we finally are having some studies that prove, and really what they're proving in relation to kids is, what we know for a fact is that chiropractors can take bones off nerves, so the nervous system is working better. We also know that with kids, the nervous system, it's important at all points of our life, but in particular as a kid, because all this development is happening and all this growth, and it's all being, it's all coming through the nervous system. What we're trying to prove and have studies to actually prove, how much is it actually affecting kids and how they develop in their health. And the initial studies indicate, obviously, kind of common sense can tell us this, but yeah, if the nervous system is working better, that kids are going to develop at a higher rate and at a more natural and healthy rate than they would be not under chiropractic care. But now we're finally having the studies that prove exactly that. And so all of this is to say that every kid, if they're under chiropractic care, it sets them up to have a better chance at being the healthiest version of themselves under chiropractic care. And so if there's one takeaway from this class that I guess I want you guys to go away with, and we'll talk about more and I'll give you more specifics, but if we just look at how we're designed and what chiropractors do, common sense will tell us that any kid is going to be a healthier version of themselves under chiropractic care.
That's when they take all their bumps, falls, splatters.
And we haven't even talked about that. Yes. Oh my gosh. Yes.
Twists, turns, tumbles.
I remember my son, and this was just in the course of 1 minute. He was walking to me. He was learning how to walk. He hit his head 3 times just walking to me. This is every kid that. You're going through all these micro traumas and big traumas as they're growing up. But that's even in addition to the fact that it's the most important time in relation to their health, because they're developing and everything's being formed. We're now as adults sitting here, we're existing and we're kind of on the health spectrum. We're more leveling off, and then eventually we're gonna kind of go downhill, where they're still heading uphill, and everything's being developed, and it's all being developed through the nervous system. And that's why chiropractic care is most important for kids. In addition to that, though, I looked into studies that just show, first of all, what are the things that kids struggle with most in terms of health. And the 3 things that, and this is just health in general, looking at health studies, ear, nose, and throat is the #1 thing that kids struggle with. Second is digestive issues, and third is neck and cervical issues. I was surprised to see that one, but those are the 3 things that kids struggle with most health-wise. And this is from birth to age 18. Those are the things that they struggle with most. So then what the study was looking at is how can chiropractic impact those 3 specific things that kids struggle with most. And what they found is that, and this is through their parents' reporting, is that 88% of kids, when they went specifically for those conditions, strictly through chiropractic care, 88% of kids reported, or their parents reported, that they had improvement with those symptoms. And what's great about, too, what we're doing when we address those specific symptoms is, what we're doing is we're taking pressure off nerves so that we're allowing their bodies to work they were intended to work in the first place.
Right.
Whereas any other means of treatment for those types of issues is introducing alternative or unnatural means to correct those same problems.
Right.
Where all we're doing is we're taking bones off nerves so that their body can heal the way it was
So
intended.
their brains can handle all the information that comes back to them.
That is exactly right. And then the #1 cause of death in America, and I think you may have been to a class before where I referenced the same study, but what do you think is the #1 cause of death in America? If you've heard me say it before, maybe don't say it, but you can. If you want to. Do you remember what it is? And it's okay if you don't too.
Right. Not off the top of my head.
That's okay. What do we think it could be?
What do we think the #1 death is?
Cause of death in America, yeah.
Car wreck.
So that's up near the top. It is certainly a common one. Yep. These are common ones. It's not the #1 one. And actually, having done this class before, a lot of people will say like heart disease or cancer, diabetes,
Right.
those kinds of things, and they're all high.
Childhood obesity.
That is also, that's also up there, but the number one cause of death in America now is poor choices. That more than anything else, and it indirectly relates to everything we're talking about. So whether it's obesity, cancer, heart disease, all those things are obviously directly influenced by poor choices. But it's the number one thing, but there's been no other time in human history where that's been the number one cause of health, because there's been outside influences that have caused health issues. Now it's all up to us. Like, it's our daily choices that influence our health most, and we're laying the groundwork for that when kids are kids. In other words, they're setting all their patterns and they're deciding how they're going to make their daily choices, and that's the time we can influence them most to make good choices. And right now, the evidence isn't great that they're making good choices, is the truth. And I understand why too. Like, as a parent, I don't have to teach my kid to like Oreos. You know, they'll figure that out on their own. But to make them like Brussels sprouts, that takes work. You know, it is more of a challenge to get them to do that. And so I understand why it's hard. And I bring all this up though too to say that chiropractors are a little unique in terms of, like, in comparison to other healthcare providers, and that, so for example, like, we have a family practitioner that we see, and he's really good. I like the guy. And I love when we don't have to see him for a few years, because, like, it means that there hasn't been an emergency or anything that we've really needed his services for. Where the kids that we see in this office, we see them pretty regularly, because the goal is eventually with kids is always maintenance. Like, we're just making sure if they have a subluxation, if there's a bone out of place, we're taking it off, we're putting it back in place to take pressure off nerves. And the goal is maintenance so that they stay healthy. But what's unique about that, as opposed to other healthcare practitioners, is that we actually get to influence their decisions more than our MD does.
So I have a question.
Yes.
Would continued chiropractic care
Yes.
strengthen a bone to help rebuild a broke bone in children?
So meaning,
Just
so
like the
that it'd be less
sliding.
likely,
Okay.
less likely to break. Is that your
Yes,
question?
less-
Less likely. So yeah. So what I would say, yes. The answer is yes. Is
Okay.
that, and that doesn't mean too that you're
Right.
bulletproof, but
No.
what it does mean is that when the human frame is in alignment, whenever there is an issue, it can handle those issues better. So that directly relates to, if you, I don't know, whatever it might be.
More or less the heal time for a broke bone.
Yes, but also there's less stress on joints when everything's aligned properly, so that when there is a collision or accident or those kind of things, that bones are less likely to break, or the severity of that trauma would be less likely or less traumatic than it would be if you weren't in alignment. So yeah, no, it's a good question. But yes, so so less likely would be the answer to that. And I'll relate this too, because in real time, I guess, or real world scenario, I tell my daughter often and it started with, actually, so like apples, for example. She loves apples, but what she doesn't love is the skins.
Mm-hmm.
And so for not years, I'd say probably weeks and months, I was telling her she has to eat the apple skin, and she would of course eat the meat of the apple but leave the skin. And this was a battle for a while, and I kept telling her, and the reason is that the majority of the nutrients are in the skin, like that's why I want you to eat it, not because I'm a jerk. I just want you to get the nutrients, but she doesn't like the skin. So eventually this went on for a while, but finally I saw her eating the whole apple, and I said, "Oh, you're eating the apple?" And she said, "That is the healthy part." Like, and she was making a healthy choice, and I finally won. It was such a victory that I've been trying for weeks and months to get her to eat the skin, and finally now that she's like closer to being an adult, she's 14. Like, when she eats an apple, she bites it into an apple and eats it, and it's fine. But my point in saying all that though is that there's influences on kids to make those kind of choices, and the biggest one is always going to be your parents, of course. Like, but in addition to that, I love that we can be backups to parents, that we're also the people telling them to eat apple skins, and because we see kids regularly, we're one of the few people in their lives that can help steer them to make those kind of choices, so that parents don't have to do it all by themselves. Mm-hmm. And in addition too, like, we're going to tell parents to eat apple skins, but then hopefully that will trickle down to kids. But in addition to that, it's nice when we can just be a backup to parents and help your kids make healthy choices, because the truth is, like, in this business, you know, again, the reason we're in this business to begin with is because we care about people and we want what's best for them. And what's nice is because we get to see them more regularly, we have a bigger impact on those on patients than we do, say, again, the MD that we haven't seen in the last year and a half. Like he really is limited in what he can do, where we can hopefully make a bigger impact and have parents not be the only people in their lives that are helping them make good choices. And I want to share this only because, as you guys know, I'm a chiropractic assistant. I'm not a chiropractor, and Dr. Brandon can weigh in on this too, but what Kathy has explained, Dr. Kathy has explained to me, but I've heard other chiropractors say the exact same thing, is that when they adjust kids, that the bones feel like they want to go back into place. As opposed to, I've never heard her describe that with an adult, where,
Right.
you know, we have muscle tightness and stress and things that kind of prevent us from, or make the adjustment more difficult. But for kids, it's actually, it does feel for them like the bones want to go back into place. And I think probably part of it is because the subluxations haven't been there as long, but also there usually isn't as much emotional and like stress that comes along with it that also makes it more difficult when we adjust. But what's nice is too, for kids, it's a simpler process where, and especially, it's really fun when we adjust infants in the office, because like the whole office gets quiet. Like there's just something different about an infant being adjusted. But when I've seen her adjust, which as opposed to, you guys know what regular adjustments are like using your hands, it's more like gentle pressure with fingers, where it's just a gentle nudge that makes the bone go back into place. But it also makes the procedure a lot easier for infants and for doctors for that part. I mean, it's really just a more gentle adjustment. I'll also share this too, just because working here now, I've been here 14 years, Byro, is that there's all these individual cases and stories that I've got to experience. But I started my first month when I worked with Kathy. There was a little girl that came in. She at the time was 4 years old. And she was seriously one of the cute, I've met a lot of cute kids. She might have been the top. Like she was one of the cutest kids I've met. But, and now she's a teenager. Like she's closer to being an adult. She's like 20 years old. That ages me. I've been here a long time. But when she started, the reason she came into the office is her grandparents were patients. And she was having digestive issues, just like we talked about in the study. But it had gotten to a point where they've tried different medications. They tried lots of things. None of it was working, and the next step was exploratory surgery on this 4-year-old to determine what her digestive issues were. Her grandparents convinced her mom to have her come in as a patient and try chiropractic care. I'm pleased to say by the third adjustment, things were starting to normalize. Like we absolutely knew we were on the right track, because she had not had this type of progress in a long time. By the 5th adjustment, it was as if there was never a problem to begin with. We had resolved the problem. She had a subluxation in her low back that was causing nerve pressure, that was absolutely causing her digestive issues, that we were able to resolve with 5 adjustments, and it was as though she was just a normal kid that had never had a problem to begin with. For me, as someone new to working in a chiropractic office, I was like, I mean, literally, but also subjectively, like, holy crap! Like this kid now has a normal digestive system. And what's more is, like, had her grandparents not been coming as patients, that kid would not have come into her office, and then she would have had exploratory surgery. And everybody's meaning well, they're trying to do the right things, and yet, I mean, where you see the road this can go down, where she has surgery, and they're trying to find something, and maybe they find something, but it's not the actual problem, and then she's had surgery that was unnecessary, and then maybe additional treatments, where 5 adjustments fixed the problem, and she had no negative side effects. It was also a less costly solution to the problem. But my point in saying all this too is that's one kid. She's not alone. Like, how many kids have digestive issues as they're growing up, and other issues? We've seen kids with respiratory issues that get better under chiropractic care. We had a mom that it was just a great situation that we got to be a part of, where he was having severe behavioral issues. You remember this kid in classrooms? And he, great mom, great kid, but in the classroom was just having severe behavioral issues. so she took it upon herself. She came and tried chiropractic care, but then also closely documented the amount of incidents that he was having in the classroom without chiropractic and with chiropractic. And it was undeniable.
Yeah.
Like the more we looked at it, like this kid was just getting better. Like his behavior was improving. Nothing else had changed at home.
So
It was
his mental health as well.
it definitely something, yes. And really what we know for sure is that we're allowing the brain to communicate better with the body and the body back to the brain. And when we do that, like often we're surprised by the results we get. But this kid, there's no question, like he was diagnosed like ADD and different things that, and maybe some of those are true, but what we know for sure is that through adjustments, his behavior improved, and he was having better results in school and at home, and it was a wonderful thing. But I think, how many kids do we know now that have ADD diagnoses and behavioral issues that, I know the common thought is not to try chiropractic care for these types of issues, but it's a safe way to address these types of issues. Exactly, and there's never a downside to them either, as opposed to medication and other things where we can see long-term issues. There's no long-term issues with chiropractic care.
Medication fixes one thing to cause 20 others.
Exactly, thank you. And
There's no side effect. I mean, the only thing about it is there's a positive side effect.
Yes.
So,
Yes.
and you can, of course, you got bad chiropractors, and trust me,
Oh, there's always
I've seen
outliers
more.
for sure.
Yeah, no,
I've seen
you're right.
more.
I mean, in any profession, you can find good
Yeah.
ones and bad ones, that is true. Then I also looked at cost effectiveness of any type of treatment for kids. So what I found is that, and this is true, so the most common surgery as it relates to spinal issues is did I write down the exact name? It's a low back surgery where they're doing spinal fusion in your low back. Like that's the most common type of spinal medical treatment that I could find. So that would be kind of a direct alternative to chiropractic care. That one surgery costs more than a lifetime of chiropractic care if you started as an infant to 125 years old. Yeah, that if we look at, and I'm not saying it's cheap because it's all relative, right? And I understand if you only have so much money, you only have so much money. But also if you don't have chiropractic care, the likelihood of having that type of surgery increases. And one of those surgeries costs more than a lifetime of chiropractic care until you're 125 if you started as an infant. And so by relation or other treatments for these types of issues, it is by far more cost effective. And who would rather go to a chiropractor each week as opposed to having a spinal fusion surgery?
Right.
That it also is just a better form of treatment. And I will also share this because I have Kathy in the back of my head saying too, Don, don't go over. So we have a patient that what's unique is he started care as an infant. He's now in his late 50s, but he's stuck with chiropractic care that whole time. He's never like gone out of chiropractic care. He treats it like brushing his teeth. Like he always goes to his chiropractor. Has said since he was an infant to now in his late 50s. I'm usually good at this only because I've done it a long time. That if I look at someone's x-rays, I can tell you roughly how old they are, just because we all tend to follow the same patterns of degeneration. And that almost proves true, except with this guy. So with this guy, if I look at his x-rays, I would tell you he's in his maybe early 20s.
That's exactly
That's
what I was
nice.
thinking.
It's true, it's true.
The crazy thing about this guy, if we're referring
it
to
is,
the same
I'm
guy,
sure the same guy.
is he doesn't have a desk job. He is hard on his body.
Mhm.
Like he's worked manual labor his entire life, and that I look at x-rays a lot. That's hard on your body. That's
Yes,
hard
yes.
on your spine. Not on his. It's incredible. It's one of the most incredible things I've seen.
It's true.
Yeah.
Yeah, our former employee called him, his nickname, I think affectionately, was Beautiful Bones. Like, he called him Beautiful Bones. And it's true, because when you look at his x-rays, like it's kind of very definitive evidence that if you can take care of your spine well, for as long as you can, like that the results are, they're undeniable, like that your spine will be in a good position, but also looking at how he lives his daily life, like he's got 2 jobs, he's not slowing down, he's aging the way any of us want to age. That if you have a good spine and a good condition, you're less likely to slow down as you age, which is what we all want.
Right.
And he's just the poster child for it. Like, I just don't know anyone that has started as an infant and has kept with it, like, religiously throughout their lives, that he's just a poster child for it, that, yes, if you can start early and stick with it, you'll be better off as you age.
Yeah.
It's true. And so, and really, and that my point in saying all this too is like, it relates to me and my family, but I'm sure yours as well, is that I think what all parents have in common is that we want what's best for our kids, and at a minimum, as good as what we've had, but better than what we had, I think is what we all want. And so for me, like, that's the incentive for me, where I know too much about chiropractic care to not have my kids under regular chiropractic care. Like, I know that it makes them the healthiest version of themselves, which is what we all want for our kids.
Mm-hmm.
And so for me, that's what I want, but I want it for all of our kids, like that. You know, we want what's best for our kids, but it always starts with health. That if it's the one thing that if you don't have it, it's the most important thing. But I think that's double for our kids. Like, when our kids aren't healthy, there's nothing worse than that.
Mm-hmm.
And so I think, for me, I'm passionate about trying to have as many kids under chiropractic care, even if it's not with us, like, just that they're gonna be the healthiest version of themselves if they're seeing a chiropractor.
Yes.
And so in saying that, as part of this class, something I always extend is if you have a kid or know a kid that you feel like would be at least benefited by finding out if chiropractic care can be helpful, I will waive any cost that comes up for their exam in doing that, just to see if chiropractic could be helpful. Because I've just seen too many good things come from kids being under chiropractic care, that if cost is ever an issue, we'll waive that as being an objection, to at least find out if chiropractic could be helpful to them. So I appreciate you all being here. I think we made it well time-wise. I think Kathy would be proud of me. Somewhere she's smiling.
Yeah.
Because she's kind of the queen of punctuality, so for her, I try to keep that in the back of my head. I gotta be punctual.
Yeah, that's what me and my husband were just talking about.
What's that? Punctuality? Because it's
He's
not.
a truck driver, so
Uh-huh.
he's always late.
Yeah, that's kind of my thing too. I don't think first of punctuality, so I have to remind myself. So I thank you guys for being here. Our next class is Hydration Nation, which this class scheduler did a bad job of. We did this class like 2 weeks ago, and I kind
That's
of
fine, I wasn't here.
We're not perfect.
Well, I think it was actually last week.
Okay, yeah, it was last week.
Yeah, I was bummed because I was gonna be here, so, yeah.
Yeah, so we are doing a repeat of it next week, but it is a great class, and just like we talked about with our vital needs, like, water's such a big deal, and I think people always go to food as being, and food's important too, like as far as what we eat, but man, hydration's so important. And so if you're able to make it to that class, we'd love to have you. I thank you all for being here. If there are any kids that you would like to talk to me about scheduling, I will be here after class and I'd be glad to help you, but whenever you talk to me, of course, I'm glad to help.
Okay.
Thank you guys.
Thanks, Tom.
Absolutely, yeah.
Of course, my pleasure.
I always love this class.
I've got a grandbaby coming in December, and